Emerald podcast series. Research that makes a difference.
Welcome to the Emerald podcast series.
In this series, we speak to experts from around the globe using research to create real impact.
In each episode, we explore the role of research within the context of the environmental, economic, social, and political challenges facing our society, and look at the ways in which research, policy, and practice interact to affect communities around the world.
We're your hosts. I'm Daniel Ridge.
I'm Helen Beddoe, and we are publishers at Emerald Publishing.
In this episode, we will be discussing the ways in which the COVID-19 pandemic has exposed inequalities in the UK food system. In March 2020, when the UK went into lockdown, the food supply chain was severely disrupted. Not only did consumers begin stockpiling and donating less food to food banks, but the international food chain was hampered by export restrictions. These, among other factors, disproportionately affected low-income households and exposed deep inequalities in the UK food system. Here to talk about this, we have Bob Doherty.
I'm Bob Doherty, and I'm an academic based at the University of York, and my research area is very much looking at pro-social market mechanisms within the food system. So I research social enterprises and mechanisms that reduce poverty and inequality in the food system.
And Madeleine Power.
Hi, I'm Maddie Power. I'm a research fellow at the University of York in the Department of Health Sciences, and I look at poverty and food poverty and the use of food banks. And I often use participatory processes like co-production to do so.
In early April 2020, along with co-authors Katie Pybus and Kate Pickett, Bob and Madeleine co-authored the peer-review article How COVID-19 Has Exposed Inequalities in the UK Food System, the Case of UK Food and Poverty, published in the Emerald Open Research Gateway, Sustainable Food Systems. In it, they outline how the current pandemic and associated lockdown have revealed fundamental issues surrounding food insecurity, particularly as it affects low-income households. So, in your article, you explain that even before the pandemic and lockdown, inequalities in access to food in the UK already existed due to austerity policies beginning in 2010. To begin with, can you explain, prior to the pandemic, the implications of these policies on the lives of lower-income individuals and families, and the role that food banks played in this context?
So since 2010, we have seen a very sharp rise in the use of food banks. And before 2010, we didn't really have food banks in the UK. They weren't very well known. And we saw a very sharp increase in the number of people who were using food banks. And this seems to have been quite closely tied to a series of policies that were rolled out since 2010 around welfare. So things like the benefit cap, particularly now the 5-week wait for universal credit. So even before the pandemic, actually food insecurity was increasing sharply in the UK, and food banks were a key response to this increase in food insecurity.
And also, if you look at from 2018 to 2019, the Trussell Trust actually gave out 1.6 million food parcels. Now, if you compare that to 2010, that's a 26-fold increase in the number of emergency food parcels that were given out by the Trussell Trust. And bearing in mind the Trussell Trust don't represent the whole of the food banking system, that really does illustrate exactly what Maddie was saying about the sharp increase in the need and the demand for food aid in the United Kingdom.
Right. So the Trussell Fund, that's an NGO, and that has over 1,200 food bank centers. Is that correct? And then you also have a system with independent food banks.
Yeah. So you've got the Trussell Trust, which is a charity, and then you also have Fair Share, which is another charity as well. Those are two very large organisations working in the food aid provision, and then you have a raft of about 800 independent food banks up and down the United Kingdom.
So when the pandemic began and the lockdown began in March, we've now been in that for several months now. How did these food banks respond to it?
Well, I think what was interesting was if you cast your mind back to March, what you had in the United Kingdom, which didn't necessarily happen in all other European countries, you had this manifestation of panic buying and stockpiling by individual households, which meant you had these media images, and you would have seen them if you walked into supermarkets, lots of empty shelves. And I even, from my own experience, remember going into a supermarket and somebody's shopping trolley was just completely full, piled up with just breakfast cereals. So people were obviously hoarding and stockpiling. And at the time, there was no quota. So the supermarkets hadn't set a limit on the amount of each individual item that people could purchase. And that's a real problem, particularly for independent food banks who rely on donations within supermarkets, or people when they're in a supermarket putting, food that they may deem, not necessarily they need, or they want to donate it. They put it in a basket in the supermarket, and that will go to the local food bank. Secondly, some food banks, they'll receive donations directly from supporters, and they'll use that donation money to go into a supermarket and buy bulk. So they might buy, 80 packets of pasta, or large numbers of tinned tomatoes, or whatever, things that make up a food bank parcel. But if the shelves are empty, and particularly what you did find was that those were some of the food items that people were stockpiling. That creates a real problem of supply for that segment of the food banking system, and you could see that combined with a lack of volunteers, because people were worried, and volunteers in the food banking sector are not exclusively elderly, but are dominated by elderly people. You had a real breakdown in the independent food banking system, which kind of demonstrated its fragility, really, in the light of the pandemic.
Yeah, so looking at the food banks, you had mentioned, Bob, that people were stockpiling, and so now that it's been several months that we've gotten used to the pandemic and the initial crisis is over, have people stopped stockpiling? Has the food supply chain evened out?
Yeah, I think what you find, and if you talk to supermarket retailers, there are still some stockouts, particularly of some goods. But what you're finding is you don't have the kind of image of these empty shelves anymore. And what some supermarkets have done is they've just reduced the number of stock lines in store, and so they certain products will occupy a bigger space just to illustrate, or to kind of provide the image, or demonstrate to consumers and the public that the shelves are not empty anymore. But you will notice that still certain items, because of increases in demand, really, are still in shorter supply than others, and you are getting still stockouts of certain product types. And you can see that in the data, because what you found in the with people being at home more is that people's purchasing has changed. And so you've got an increase in demand of certain items, and certain companies, certain products even had record sales in the months of April and May, because of people in lockdown, and more home cooking, more food consumed in the home.
Right. So that was another question I wanted to ask, is that with the closure of restaurants, how has that affected the food supply chain and food donations to charitable organizations?
Well, I'm sure Maddie can build on that. But what you found is obviously the food service sector, hospitality, completely fell off the cliff. And what happened was a real quick kind of move by different food providers to try and adapt to that situation. So what we've seen is quite an emergence of direct supply from suppliers of food, from farmers, or from those wholesalers and distributors that used to supply food service, actually starting to supply direct to consumer, direct to customer, but also starting to develop new relationships with retailers. But also, you've seen the emergence of some quite interesting alliances between companies like Nando's and Leon Restaurants, and charities in places like London, who have been working together in partnership to actually get food to vulnerable groups. So you have seen some real social innovation in the food sector, particularly from food service, to try and circumvent the kind of closure of that sector. And also, what happened in food retail was that there's an increased demand for staff, and so you did have some redeployment of staff and workers from the hospitality sector into food retail, and the Co-op in Manchester was one of the kind of initial movers in that space, because they had a big recruitment drive to recruit staff from hospitality into their retail stores that became very, very busy.
So the food was successfully diverted from restaurants into being able to be consumed, but then also into these food banks as well.
I wouldn't say everybody was successful. I mean, if you look at dairy farmers, they've really struggled. Milk's been a real problem, because obviously a lot of milk is consumed in food service, if you think of the number of coffee bars. So actually a lot of dairy farmers have had to reduce yields, actually cut back on inputs to actually reduce your yields, because they didn't have a market for their liquid milk. Different if you were supplying maybe a cheese manufacturer or a butter manufacturer, but if you were providing liquid milk for food service, there was kind of a real problem in that particular area in terms of the food system.
So Maddie, has there been an uptake now with donations to food banks, and are people having more access to food, these lower income families?
To some extent, although the food banks are still very reliant on these more centralised systems. So FareShare played a really big role in the distribution of food from food suppliers to food banks. But there's been lots and lots of teething issues around this. Partly FareShare actually weren't really set up in all parts of the UK, and certainly in parts of Wales, they initially didn't have any bases and couldn't supply the food banks. And there was also still a cost for food banks. So the food banks had to pay FareShare to get food. So even though the theory was perhaps a good one of a centralised system of food supply and linking up wholesalers who might not now have a market with food banks who have increased demand, on the ground it was very difficult. And there was lots of food banks who didn't get the food they needed, or got food that was past its sell-by date and mouldy, or they were required to pay for the food that they were being given. They didn't have any money to do that.
So where are we now, a few months into this pandemic, in terms of food banks, donations, and people being able to access food in food banks?
So it's now much better than it was. I mean, I think with everything in lockdown, there was an initial period of sort of shock and surprise, and no one was ready for it. And certainly with food banks, they weren't ready for it at all. And the initial month or so, or 2 months, was chaotic, and people didn't have the food they needed, and the supply systems weren't set up. Now they are set up, and whether it's at a kind of more centralised level with FareShare distributing food to food banks, or whether actually a lot of it is within local authorities who have coordinated food provision, either through a food bank or through their hubs. So it's now much more established, and the data isn't clear yet, but we're likely to see an increase in food donations direct to food banks as they would have had before the crisis. And they've also seen a significant uptick in financial donations since the start of COVID. So that can now be used to buy food in supermarkets as they would have done. So there's now a steadying of it, but they're expecting increased demand even further as the furlough payments end, as unemployment increases. So whether or not they'll be able to keep up with that demand is unclear.
When you're doing your research and pulling your data, where are you getting your data from, and how are you able to share it with others?
I think the data on the food supply chains, if I could start there, looking at percentage of food that's imported and then breaking it down by a product type, that requires the knowledge of trade statistics and how to analyse those trade statistics, and that data is readily available on the Office of National Statistics. There might be a little bit of a time lag with it, but you can certainly access it and number crunch it, which is what we do at the University of York and in the I Know Food programme, which me and Maddie are a part of. And then also in terms of other data, like market data, so we were able to track the trends in terms of how people's consumer habits were changing. You can do that by looking at the Kantar World Panel data, which shows you how people's consumption habits changed over the pandemic. And so really what we and Maddie will talk about access to food banking data as well, is what you tend to do is use a mixed methods approach. You gather data from different sources, and you pull that together to make a an article that illuminates some of the vulnerabilities and the fragilities that are going on. And remember, this was a point in time. So this was something that we were having to collect data quickly in the weeks where we were writing the article. And I think the other benefit of an article of this type as well is the fact that we were very pleased that it was open access, because it meant that not only academics could access it, but also practitioners could access the article as well. And what we did find was we did receive emails from a number of food bank leaders who said, thank you very much. We don't normally get access to academic articles. We were really pleased, and it's helped us to inform our strategy in the next few months. So for us, that was really, really pleasing. And Maddie will have her own insights on that as well.
So for you, Maddie, working with food banks, having the article open access, did it give access to people that you wouldn't have expected, or to practitioners, people out there in the field?
Yes, absolutely. And that was something that we were very keen on when we were writing the article, that it was accessible and available to a broad sector. And so, as Bob says, we got emails from some food banks, which I think he and I were both quite pleased about, saying it made them rethink about their own practices in the light of the arguments that we'd made. Because for food banks, a lot of them are just working kind of hand to mouth, really. They're just dealing with the day-to-day, and they don't get to reflect on that. So I'm pleased, and I think I don't want to speak for Bob, but I think we were both pleased that the article had a role in encouraging that reflection.
If this is protracted and there is a second wave, how will that continue to affect food banks, food donations, and the supply chain?
Well, on the supply chain side, I think Bob would be much better placed than me, but I would imagine, in the way that has happened with food banks, is that they'll actually now be able to adapt better. So certainly with food banks, if we were to see lockdown again, there will be a greater ability to adapt to that new circumstance because they've adapted in the past. The problem now is that so many people are experiencing food insecurity that demand is very high and is likely to increase. So it's just continuing to meet that very high demand when they're not really set up. Food banks were only ever set up to be a temporary service, and they're now becoming really part of the welfare state, and they're not really able to do that.
Right. So looking at the long term, have we permanently affected the way food bank structures work because of the pandemic?
Possibly. And I think there's some concern within the food bank sector that could be the case. So the sort of broader framework for this, and I suppose Bob and I are both academics, so we do look at things in a kind of more theoretical way, and the long-term implications of all of these events is that lots of food banks and lots of those working in relation to food banks were quite resistant to food banks becoming permanent, to them becoming part of the infrastructure of how welfare is given in the UK, how support is given. And what we've probably seen is that in the need for them to establish themselves to meet sharply increased demand over this period, they have set up links with centralised supply chains. They have set up links with local authority and the welfare system at a local level, which means they're becoming further institutionalised. So they're further part of a system, and it's very difficult to undo that system. And I suppose what really has happened is that they become further entrenched, which might be good in some respects, that people need that support, but actually before this point there was huge concern that would happen, and I think there's lots of people would not like that to be the case.
Right. There seems to be a very strong moral dimension to this, of the responsibility of the government versus the private sector. And food banks seem to play a precarious role between the public and the private partnership. Do you think this is viable in the long run?
I would say it's not, just from the perspective that we know from a wealth of research that only a minority of people who experience food insecurity, so experience difficulties around accessing food because of money, access food banks. So food banks aren't a solution to food poverty. They don't address food poverty. So it's very problematic if we're entrenching food banks as a supposed solution to food poverty. They're not going to solve it. And we need to actually be looking at other solutions if we really want to address growing food insecurity.
Right. So how has COVID-19 specifically exposed inequalities in the UK food system?
I think that, going back to what Maddie was saying, the reason why food banks aren't a permanent solution is because a lot of people actually have a stigma about going to food banks. They're embarrassed to go to food banks, and they work out lots of other different mechanisms with networks, with families, to actually, and adults will go without food themselves to feed their children. So, in a way, the number of food banks and the number of parcels that food banks provide is only one indicator. It's not the whole story. There's a hidden story there of food insecurity and food poverty in the UK. And I think what COVID-19 did was just expose that fragility even further. And obviously that was accentuated by initial stockpiling and being food banks not being able to get their normal supply. Also, there is to get a food bank parcel, there's a referral system. So you have to go through a referral system, and because if you look ahead, if we see a rise in unemployment, which is forecasted and predicted, will the referral system also be able to keep up with the demand of people wanting to access a voucher to use a food bank? And I think the other important element of this is that food banks in the main, and Maddie might say this is changing, but in the main they offer a food parcel that is mainly made up of processed food. It's made up of tinned goods, it's made up of dried produce, and there's very little fresh produce in that food parcel. And I think that's a problem for the health of the nation as well, because if we are making that inequality even worse by actually providing a diet that's undernutritious, that adds to people's issues in terms of lower immune system, which is obviously proven to be a difficulty if you have the virus, then that's just creating a two-tier food system. And I'm sure if you speak to policymakers and you speak to industry, the last thing we need in the United Kingdom is a two-tier food system, a food system for the poor and a food system for the rich. And I think for me, that is the real concern, is that you just reinforce those inequalities even further.
Right. You also mentioned in your article that people from different ethnic backgrounds, cultural backgrounds, they're not having access either to the types of foods they would normally eat. Is there anything you could say more about that?
Yeah, so that really came out from some work that we did in Bradford now a few years ago, where we were looking at, so Bradford is a city in the north of England, and it's very ethnically diverse. It's got a very large Pakistani Muslim population. And we did some work in the food banks in Bradford about how they were giving food and who was receiving the food. And we found that they didn't have many Pakistani Muslim people going to the food banks, even though in that population there's quite high deprivation. And the food that they were giving out wasn't culturally appropriate. It'd be a very standard parcel of food. And it wouldn't be appropriate to people's needs in terms of maybe halal food. And so that's increasingly a concern as COVID goes on, because we're seeing that BAME populations are experiencing a very high burden of COVID and of the inequality that comes more broadly economically associated with COVID. So there's a threat, there's a danger they'll be excluded from the services they might need to access because food banks can't provide and don't provide culturally appropriate food.
So is there a way to reach them and to get them the food that they need?
Food banks really should be thinking more carefully, and some are, absolutely, many are, about the cultural needs of the people using the food banks. Lots of food banks are provided by Christian churches who can be white, and there can be, perhaps in the midst of everything else going on, that doesn't seem to be a concern. And because maybe they don't have many ethnic minority people using their food bank, they think it isn't a concern. So there's a role for food banks to play in making themselves more inclusive. And there's also probably the acknowledgement that maybe some communities might not want to go to the food bank. So it's about how we can make that food available to them if they don't want to come to the site of the food bank itself.
Well, clearly the country is going through an economic crisis because of the lockdown and the pandemic and that. Is there more of an acceptance now, possibly, of people going to food banks because we know that there is this crisis, that more people are having to deal with the situation?
I would say there's probably more of an acceptance of people getting food charity in some form. So food banks are one example of people getting food charity. They might also get a food parcel from a local charity that works with families, so that used to run a community centre and supported families and who are now distributing food parcels. and lots of schools are distributing food parcels rather than giving food vouchers. So there's probably been a normalisation of food charity and accessing food charity in some form. I think food banks themselves and going to food banks still has a strong stigma attached to it. And it's possible that stigma might have been enhanced because actually now if someone's going to a food bank, it's a very transactional experience. So that it's not a kind of holistic experience. They don't get care, they don't get conversation, they don't get advice because people can't do that within the confines of social distancing. So it becomes very transactional. And because of that, it might be even more stigmatizing than it used to be.
Bob, on April 30th of 2020, you and Professor Fiona Smith gave oral testimony to the House of Commons International Trade Committee on UK food system as it responded to the COVID-19. Could you tell us about the purpose of the testimony and what you discussed?
Yeah, that's a very good question. It was the International Trade Select Committee who were having an inquiry on the impact of COVID-19 on the UK food system. So it was looking very much at the problem from an international perspective. And we were asked to provide oral evidence along with two other industry representatives. One was Ian Wright from the Food and Drinks Federation and a representative from the British Retail Consortium. And we all agreed actually on certain key points. One, that during the pandemic, and one of the reasons why we were quickly able to kind of refill those shelves that were empty in the early stages, was that I don't know whether you were aware, but actually in the UK, 46% of our food is imported from other nation states, and 30% of the food actually comes from the European Union. And that's a mixture of fresh produce. So we import a large amount of our fruit and vegetables from the European Union, particularly from the Netherlands, Italy, and Spain. Plus, we import quite a lot of our ambient goods. So tinned tomatoes, pasta, baby milk, all sorts of different goods from the European Union. Now, what the single market provides is a very frictionless movement of goods. And one of the things that really held up in the COVID-19 pandemic, and it still is holding up today, is the just-in-time supply chains from the European Union and that frictionless movement of goods really work very, very well. And what I was trying to emphasize in that trade committee was that's one of the reasons why we were able to maintain supply in the grocery retail sector in the COVID-19 pandemic. And it was because of the speed and the fact that goods come very quickly from Calais to Dover every day. And what supermarkets have got used to over the past 15 years is very much a just-in-time supply chains to make them more efficient. And so they'll order today before 12 noon from their suppliers of fresh produce or ambient goods in Europe, and they'll get the delivery tomorrow. So it's called day one for day two. And so, but if you then start to introduce delays, so one of the concerns that people do have is if we were to enter a second wave of the pandemic at the same time as we have Brexit, it's very, very important the UK has a good trade deal that maintains that frictionless movement of goods across borders from Spain, from Italy, from the Netherlands, to maintain our supplies. Because if you think of fresh produce, you can't really stockpile those items. They're perishable. That's the interesting thing about the food system. If you compare it to something like car components or electrical components, the produce is perishable, and so we've got to understand that when we're entering into these big geopolitical changes within the United Kingdom.
So has the just-in-time supply chain, has that recovered since the initial shock of the lockdown?
Yes, I think in most cases it has recovered and it's proven quite resilient, but it could have been different. So food has managed to keep going, keep moving from the European Union to the United Kingdom, and that's been a success, really. But if you think of, say, fresh vegetables, for example, we get 36% of our fresh vegetables from the European Union. They mainly come from southern Spain. Actually, southern Spain had a very low incidence of COVID-19 outbreak, and it could have been different. So in those farms and in those packing plants, for fresh vegetables, there was a very low number of COVID-19 cases in southern Spain. So actually, that you could argue was a little bit of luck and fortune in some of our supply chains continuing to supply the UK. Also, because there was some labour loss, so people did get sick, and there was a lower number of lorry drivers available. What the UK government did, it did introduce some flexibility into the system. It took away the cap on the number of miles travelled and also the number of hours that lorry drivers were restricted in terms of driving. So it meant that with a combination of measures and the free movement of goods across the European Union, for certain supply chains, they were able to continue effectively.
So looking forward at the way that the UK consumes food, gets it from abroad, is there a push to make the UK more independent in its own food production?
It's a debate. People are obviously, you would have heard in the media discussions about self-sufficiency, reshoring of food supply. But the UK has always existed within a global food system. Even if you think back to the late 1980s, we were still importing 35% of our food. I take one good example. Bananas, for example, is Britain's favourite fruit. And obviously, you can't grow that in the United Kingdom. It's a crop that's a tropical crop. It grows in West Africa and Caribbean and Central America. And so it's more nuanced than just thinking of self-sufficiency. However, there are certain crops, particularly British seasonal vegetables and fruit, that people could argue could be grown in the more could be grown in the United Kingdom, but that also relies on other factors. It's more complex than just than just saying you can turn the tap on, because it needs investment, it needs land, it needs labour. Also, we have an elderly, aging farming population. Lower number of young people going into farming. So it's not as straightforward as maybe some free market economists would think. There's a lot of complexity and infrastructure and questions of land use that would have to be considered before you can make those accurate calculations to whether the UK could be more self-sufficient.
In recommendations that you might make to the UK government about what they could do about food insecurity and the food supply chain, what would those be?
In terms of food supply chains, my strong recommendation is people who are negotiating the trade deal with the European Union have a full understanding of the complexity and the nuances of the food system and the food supply chain. It's not the same as electrical components or car parts. It's perishable. We source food from thousands of different producers. 14 to 15% of our food also comes from less developed countries. And so in any trade deal, in any trade negotiations, that needs to be understood. We really need to be able to pinpoint exactly where our food is coming from by doing good trade analysis. And we need to consider that when we're negotiating trade deals, because our food system really relies on the frictionless movement of goods across borders to keep the consumer in the UK satisfied across the 12-month period.
Right. And then looking now at inequality, there's sort of a trickle-down effect, right? So we have food coming in from out of the country, and then we have it getting into food banks. So Maddie, could you say something more about that, about the food banks and the way that they may operate in terms of this larger food chain?
In terms of food banks, I suppose one thing that's really important to bear in mind with them is that they're so closely tied to poverty more generally. So it's good if they've got the food supply that they need that's coming from various sources, and that might now be increasingly centralised, but it also might be them buying food in supermarkets. And as long as that food is there in the supermarkets, they will be able to buy that food. They don't really need a diversity of food because the parcel that they give out to people is so limited. It's a very restricted parcel of food and it only has dry food in it. So in some ways, in terms of any time limit or kind of temporal implications of when that food is coming into the supermarkets, that wouldn't really have any bearing for them. Going forward with food banks, I just think there's a great concern from both individual food banks on the ground as well as the governance organisations, so that'd be the Trussell Trust and the Independent Food Aid Network, about increased demand and people not getting the support that they need from the welfare state. So there are lots of joint calls at the moment out from various organisations for the government to make certain amends to the welfare state. So that's things like the benefit cap or reducing the 5-week wait for universal credit, which mean that people have the income they need so that they themselves can go to the supermarket and buy the food that Bob is talking about.
Right. So that would change the question of stigma attached to a food bank, so that it would give more liberty to the individual to be able to go to a grocery store and pick out their own food.
Yeah, exactly.
Yeah, I think what Maddie was saying there was the notion of cash first is best, particularly when the system broke down like it did at the start of the COVID-19 pandemic, was that to reduce that stigma and for people not to have to wait and find other mechanisms of providing food for their families, that actually what the Scottish government did was they had a cash first approach. So they put more money into people's universal credit, and that was very, very welcome. It meant people could do exactly what you were referring to there, Daniel, is to actually go into the supermarket themselves and feel empowered to buy the food they wanted. And I think those are some lessons. What we really, really have to be careful about is actually making food banking the norm in the United Kingdom. We're an advanced capitalist nation. To think that, good percentage of our population actually relies on food charity is something worth reflecting upon for everybody. Do we really want a society that relies on a two-tier food system?
Maddie, is there anything you'd like to add to that?
Yeah, just to second everything that Bob says, that I think in some ways, if you look at what's happened over the past few months from a policy perspective, it's quite interesting to focus on the difference between the devolved nations. So Scotland took quite a different approach to England. So while there were these UK level changes to the welfare system, like the extra £20 a week in universal credit, what Scotland did is it put much more money initially into local hardship funds. And the idea would be that before someone went to a food bank, they would go to a local hardship fund that might be administered by a local authority and then get cash rather than have to go and get food. And if that system is set up, it means that the problems that we see in the food system don't need to affect somebody whose food insecurity is only because of low income and poverty.
So specifically in the UK, with their response to COVID-19, what have they gotten right and what have they gotten wrong in the last few months?
The furlough scheme clearly prevented the destitution, or at least unemployment and poverty, of millions and millions of people. And so the furlough scheme for people who are self-employed as well as employees has been really crucial. They made some changes to the welfare state to universal credit quite early on, which are important, like increasing the value of universal credit. And then there were additional elements like mortgage holidays. So they've been really important. I would say for me, what they've got wrong is that they didn't go the whole hog, really. They kept a 5-week wait for universal credit. So when you first sign on, you've got a wait of at least 5 weeks until you get your first payment. And if you've got no money coming into the household and that problem, you're very likely to have to go to a food bank. So they didn't change that. They also kept the benefit cap, which means that if you're in a slightly larger family, your benefits would still be limited. So you might not gain that extra £20 a week in universal credit because you're being hit by the benefit cap. So there were some things they did really well, but they could have done more and they could have gone further.
Bob, what do you think?
Yeah, also to add to what Maddie said, there was a couple of other things which are kind of key. Also, was obviously there was a big debate around free school meals during the summer holidays. Obviously, the government initially decided not to provide free school meals during this summer holiday, and then that needed the intervention of a footballer called Marcus Rashford, who it's interesting how football has become politically active during the past few months, and it led to a government U-turn. So it was the right decision in the end, but it was clear to most people that that would have been the good thing and the moral thing to do in the initial decision making. I think the other thing about the food supply chain, DEFRA has worked very, very closely with the grocery industry and the supermarkets, and they did make some of these decisions which actually helped in terms of keeping supply chains going, with taking some of the restrictions off the miles travelled in terms of logistics, and also the number of hours that lorry drivers can drive, just to keep food on the shelves. So there were some good things, but obviously some areas for improvement.
Well, thank you so much for joining us today. I think we had a really good conversation. It's covered a lot of territory.
Yeah, thank you.
That's good, and thanks.
If you're interested in learning more about Bob Doherty and Madeleine Power's work on how COVID-19 has exposed inequalities in the UK food system, you can find a link to their open access article in the show notes. Next week, Helen will be speaking with Associate Professor Johnny Jones of the Mississippi Valley State University about historically Black universities in the United States. Join us then, and thank you for listening.